So I'm holding in my hand a sleep apnea appliance. It is basically two trays, top and bottom. It fits perfectly in the patient's mouth, and it's connected by this arm. This arm makes sure that the lower jaw sticks out. Now, the reason for that is when the lower jaw sticks out, it opens up the space here so the patient can sleep. Now, there's usually a collapsed area inside the throat where the trachea goes, which causes obstruction, and that's why people can't sleep. This actually helps to open that airway by bringing the lower jaw forward. Now, it prevents you from going back during the night, and that's why it's worn at night. Okay, Michael here is agreed to do this. So the tray, the bottom tray fits over the bottom teeth. This is custom made. We took scans of his teeth. A second, let me just position this properly. Okay, you should be able to close on this now. Okay, all right. As you can see, good. Try not to bite me. Okay, great. As you can see, it perfectly fits over his teeth, and the telescopic arm gently closes your teeth together. Okay, now he can bring his jaw in, and in fact, by opening the screw in here, I can bring his jaw forward, and we're able to control that. Usually, we ask the patients to do it themselves. There's a special tool that's provided, and they're able to control how much forward. So if they're not sleeping well, we ask them to open it a little bit, and there's a dial here, and you can tell on this dial how many millimeters you're moving it. Now, Michael has been using this very successfully, and he's been sleeping very well. When he came in, he wasn't sleeping. He was waking up numerous times. He was snoring, but more importantly in snoring is that he was waking up and he wasn't getting a night's rest. And with this device, he's been able to sleep very well, and he's very happy. He's not tired in the afternoons, and there's a lot of slew of other things that that are very, very important. So it's a great way, especially for someone who doesn't want to sleep with a CPAP, or they have a mild sleep apnea and they don't really need a CPAP. This is a very, very good way to work. All right. So Michael's an unusual. You're filming this? Okay. In the sense that what happens is most of the time we see people who have a very thick. He's got a bit of a thicker neck, but we usually see people who are. He's pretty fit. Usually people who have overweight have sleep apnea because there's usually obstruction in the throat. He's actually the second patient this month that I've had who's relatively fit and doesn't have that classic thick neck that was part of the diagnosis for sleep apnea. The sleep apnea can be fatal. What happens is patients actually stop breathing. So it doesn't just affect their blood pressure, but it affects their breathing, and they stop breathing. And it takes a while for the brain to realize that there is not enough oxygen. Sometimes it takes a second or two, and then the breathing starts again. So that during the night, that causes patients to wake up numerous times during that. Somebody who's with severe sleep apnea will wake up 50, 60 times an hour. Yeah, so it's very detrimental. The biggest problem is the lack of oxygenation of the body, because when you're not bringing enough oxygen, which is getting exchanged in the lungs, and the cells carry the oxygen to different parts of the other cells in the body, that exchange does not take place, or at least it doesn't take place fully. So as a result, people can develop thrombosis. They can develop death around the extremities. The skin turns dark. I mean, it's truly something that can become a fatal. If it's not treated, it can be fatal. So normally what happens is that commonly I have patients coming in who have gone to the doctor, had a sleep study, they're diagnosed with sleep apnea, and they've tried CPAP, and they're CPAP failure. They're unwilling or unable to wear CPAP. A CPAP is a machine that is connected to a mask that gets fitted over your mouth and your nose, and it creates a positive airway, ergo CPAP. Now, they're CPAP failures. They cannot or will not wear the CPAP. So this is the second line of defense. They come in for a consultation. If we agree that this is what needs to be done, we can do the scan. The scan takes 5 to 6 minutes. The scan that's sent to the lab. The lab takes approximately 3 weeks to fabricate this device. And this is what we call a Herbst appliance. And this is probably the best appliance for this type of situation. There are other appliances less complicated, but they're not. They're more of a snore prevention, and they're just a little light. This is a pretty sturdy thing. Okay. So 3 weeks, 2 3 weeks. In your case, I think it took 3 weeks.
Yeah.
It took 3 weeks. Yeah, for a finish. So my name is Dr. Vyman. I'm a partner in your Family Dental Arts. We're at 340 72nd Street. If you think you have sleep apnea, if you have trouble sleeping, we can arrange for you to have a test. There are machines that we can rent, and you can wear them at night and see if you have sleep apnea. But if you know you have sleep apnea, or you've been diagnosed with sleep apnea and you're unable to wear a CPAP machine, by all means, we could discuss how we could help you. I've been doing this for quite a while. I'm a CPAP. I wear a CPAP. I also have one of these devices. I have sleep apnea myself, so I know how it feels. So not only do I have sympathy, we have a lot of empathy.